Good evening. My name is Susan Moon, and I'm the Executive Director for the Walnut Creek Library Foundation. Our foundation raises funds to provide free programs, purchase equipment and supplies, and add to the collections for our two Walnut Creek libraries. I'd like to thank our Finance 101 series sponsors, Kathy and Jerry Hicks, for making these programs possible. Last month, we started the Finance 101 series with a presentation on the possible effect that the new administration in Washington, D.C. has on investing. 2 weeks later, we had an engaging discussion about life insurance. 2 weeks ago, we learned about Medi-Cal planning and special needs trusts. These two topics are particularly useful for all families that have aging family members and those that have special needs. All of our topics have been well received, and the videos can be viewed on our website and YouTube channel. Tonight, we will wrap up the series with a deep dive into Social Security and Medicare. I'm pleased to introduce Ian Wetherell, a certified retirement planning consultant, one of his 4 investment-related certifications. Ian graduated from Syracuse University with the BS in economics and BA in psychology. He began his investment career with Payne Weber in New York City. Ian escaped New York in 2007 by moving to California and joined Nationwide Insurance Highmark 2 years later. He is a senior director with Principal Global Investors and assists advisors and clients in maximizing Social Security income and managing the expense that Medicare covers or doesn't cover. He is married and has 2 young children, and he enjoys running, having run 9 marathons to date. Following Ian's, because Ian's presentation is in 2 parts, first on Social Security and then second on Medicare, we will have a brief Q&A session after each portion, but you are welcome to submit your questions at any time in the Q&A box below the video. Without further ado, please welcome Ian Wetherell.
Excellent. Thank you, Susan. I really appreciate the warm introduction, and thank you all for joining us tonight. As Susan mentioned, my name is Ian Wetherell, and I'm a proud East Bay resident. I live here in Concord in the Crossings, and so I'm very grateful for the opportunity to speak to you all directly today as my hometown. And to that end, actually, I've run, I was telling Susan earlier, I've run the Walnut Creek Half Marathon every year since 2013 when I moved up here. So I'm hoping to do it again this year. But today we're going to cover 2 very important topics that are near and dear to my heart. The government administers both Social Security and Medicare, and so many people don't think to talk to financial advisors and financial planners about these 2 important topics. Yet when you stare into retirement, Social Security represents the core of your retirement income portfolio, and Medicare is one of your larger fixed expenses. So it's perfectly germane to your financial plan, yet many people don't think to fully engage their financial planner on these topics. And that's why we here at Principal have put together our seminar that we'll be sharing this evening. So, we've heard a lot in the last handful of years about Social Security and Medicare being entitlements. And I don't want you to think of them that way. But when we're done tonight, hopefully you'll think of them as the core of your retirement income portfolio and a way to get affordable healthcare coverage throughout the course of your retirement. But Social Security in particular is a forced savings account that you paid into your whole working career. So let's make the most of it. And for both of them, let's get what's yours, or in the case of Medicare, minimize the burden that it will create for you throughout the course of your retirement. Here's our agenda for this evening. If you can see the screen well, we'll cover the basics on both Social Security and Medicare. As Susan mentioned, I'll take a break after the beginning part for Social Security. I welcome any and all questions that you have. Social Security, you're eligible to get Social Security at early as age 62. And one common misconception is that, if you no longer plan on working, why wouldn't you take your Social Security at age 62 and you'll get your benefit? Most people, when they get the statement in the mail They see the number in the upper right-hand corner of the cover page. That's as far as they read. So that number is at your full retirement age. So when you collect it earlier than your full retirement age, you'll get a reduced amount. So we'll talk through the advantages and disadvantages to taking it early versus late in the next handful of slides. So you can get Social Security as early as age 62, but I would say for many of you, most of the people I've met in doing these seminars over the years, the optimal time is no earlier than your full retirement age, which is somewhere between 66 and 67. And we'll talk more about that in a little bit. So you're eligible for Social Security based on your own work history if you have, as you see on the screen, 40 credits of FICA taxes. Substantial earnings is what they call it. And you're about $8,000 this year in earnings this year to get substantial earnings. You get 4 credits, 1 per quarter. So 4 max per year. So if you have 10 years where you've made in today's dollars about $8,000 a year, you have created a Social Security benefit for yourself. And the one thing I would ask everyone to do if you haven't done this is go to ssa.gov/myaccount and sign up for an account there so you can understand what your opportunity looks like for Social Security. But they don't just look at your 10 years of work history. As you can see at the bottom, they look at your top 35 years of work history over the course of your full career. So as Susan mentioned, I was a student at Syracuse, New York, and I was a busboy at Ruby Tuesdays at the Carousel Mall in Syracuse, New York, which probably means nothing to any of you. But thankfully, I've had the great privilege to out-earn those busboy years. And as I keep working over the next 20, 25 years, those years of making a busboy's wage will fall off my ledger, looking at the top 35 earnings years, which has a benefit of indexing up my number towards the maximum this year, which is about $3,600 a month in Social Security benefits. So if you have 35 years, if you go to ssa.gov/myaccount and you look at your statement, I'll share with you one way to quickly scan your statement to see if you've got maximum earnings year. The cap this year is $138,000. I'm sorry, $143,000 this year in taxed earnings where you pay into your Social Security. There is no cap for Medicare, but they list 2 columns on your statement, your taxed Social Security column, your taxed Medicare column. So as you look at your statement, if the Social Security column is smaller than the Medicare column, that's 1 max year. If you look, and they break it down in 10-year chunks, if you look at 10-year chunks and you have 30 to 40 years of earnings history where you have maximum earnings, you don't need to work any longer to satiate your maximum Social Security benefit. But conversely, I've met with a number of people who have 30 max years. They like their job and they can stomach doing it for a few more years and they're decently well compensated. They could increase the amount that they'll receive for the rest of their life rather dramatically. So you want to understand your statement and look at those top 35 earnings years to help formulate what your income will be and your opportunities. Because the reality is the burden is shifting. You know, my wife grew up in Oahu and both her parents worked for the state. So they have full Social Security because they paid into Social Security as they went. They have a full pension from the state and they have full medical. So they just pay their Medicare premiums, which we'll talk about a little later, and Hawaii pays for their Medigap coverage effectively. So as a result, that if my wife didn't know me, she would call her parents for help. They would not be helpful because their experience is entirely different than what she and I are going through. The burden is shifting generationally away from pensions, which are offered to now only 14% of companies in the private sector, still pretty robust in the public sector, but that's shifting the burden of creating retirement income onto our shoulders. So now I have to take more money out of 401ks, IRAs, other mutual funds and investments, and Social Security is the addition to that. And I would ask you to think of Social Security in your retirement income pool as the core, because it may very well, if you don't have an annuity or a pension, Social Security may well be the only asset that lives on this earth as long as you do. So think of it in that vein as an income stream that you can manipulate now before you take it to provide lifetime income that will live every day on this earth that you do. because the pensions are slowly dwindling away because of the unwieldy costs they represent to the issuers. Social Security, as I mentioned, for many of you, this is a time at which I think in many circumstances, it makes sense to take your Social Security at your full retirement age or later. And the next slide, I'll show you why it may not make as much sense to take it earlier. But you can see if you're born 1954 or earlier, your full retirement age is 66. But for every 2 months after 1954, for every year after 1954 in which you were born, they added 2 months to your full retirement age benefit when they made this change about 25 years ago. So now you can see for myself, being born after 1960, my full retirement age right now is 67. One of the reasons that people take it early, about a third of America takes their Social Security at the earliest opportunity, which I mentioned is age 62. And one of the reasons, I'll just address it head on now, that people take it early is they think, well, Social Security is going to run out of money, so I might as well take it now so I get something instead of getting nothing later. That's fair. Social Security is a strapped system. They are money good until at least 2034. And then from there, on a go-forward basis, you'll get no less than 80% of what they promised you going forward. But one of the potential solutions to fixing the funding gap, apart from raising the income level, which has been happening, is also to push out the full retirement age for younger recipients like myself. I'm 43, and while I may not like the fact that I may not be able to retire completely at 67, but rather maybe 68, 69, or even 70, I still have 20 plus years to amend my financial plan to accommodate that. There's never been a change to Social Security to people who are soon to consume it. So no, if you're in your 50s or early 60s and you're thinking about taking Social Security, your full retirement age will be what you believe it to be, and you should get most of your money. I have a 6-year-old and a 3-year-old. I do not know what the Social Security system will look like for them, but even for myself, I know I'll get most, if not all, of what I expect from Social Security. As I mentioned, about 1 in 3 people takes their Social Security early at age 62. And often people say, well, why wouldn't I take it early? I'm able-bodied and I can enjoy it. That's great, but you can see the reduction, and a 25 to 30% reduction, depending on when your full retirement age is meaningful. And that reduction will work against you for the rest of your life. If you take the money early and you live to 95, you'll have left hundreds of thousands of dollars. The average couple taking it early will leave $240,000 on the table over the standard life expectancy. And so not only that, we'll talk about work in a second and how that can impact you negatively. Conversely, only 4% of America takes it at age 70. So you can see here, for every year you wait, assuming your full retirement age was 66, for every year you wait from full retirement age to age 70, you'll get an 8% increase in the amount you receive each and every year. And one thing I've heard recently is, well, gosh, Ian, the S&P was up 29% in 2019. And even with all the volatility last year, we're up double digits last year. Why wouldn't I just take the money out now and invest it? I can invest 8%, and I hope you could. But you're comparing apples and oranges because, again, this income stream, this increase in income, not the decrease like the previous slide, this increase is going to compound in your favor every year you live. The longer you live, the more that money will pay out to yourself, or as we'll talk about later, to your surviving spouse for you to predecease them. So you want to do a little more strategizing as it relates to when you claim, because it can have an impact for yourself over the course of your life expectancy. And in the case of letting it go to age 70, that can pay down to the second to die as well. So here is your kind of your spectrum of decision tree. Over 50% of America still takes it in the light blue before their full retirement age. And that's why we put this seminar together, because that often is not the most optimal case. My goal tonight is not to tell you to take it later or steer you one way or the other, but to make an informed decision, because the number one reason people take it early is they didn't know there were penalties for taking it early, and they didn't know they could benefit from waiting. And that's my goal for tonight in our time together. Also, I know people are starting to plan vacations again. This didn't come up as much last year given the coronavirus situation, but what I heard sometimes is saying, Ian, I'm 62. I don't really want to work anymore. I want to take some vacation. I still have a job, but I want to take this money now while I can enjoy it and spend it. And this is not the vacation fund for you in your early 60s, Social Security. And here's why. You can see for every $2 you earn over $18,960, if you're before your full retirement age, so 62, 63, 64 years old, for every $2 you earn above that $19,000 threshold, they'll withhold $1 out of your benefits. So if you're making $50,000 a year, which in the Bay Area is standard at best, then and you take your Social Security, if you were expecting a $25,000 Social Security benefit through the course of this year, and you made $50,000, they're going to withhold roughly $15,000 from that benefit. So instead of getting $25,000, you'd only get $10,000 in income. Now, those withheld earnings eventually are returned to you. Your Social Security amount at your full retirement age and beyond would be indexed up slightly to increase what you'd receive. But at the end of the day, it's a very inefficient way to access your Social Security if you're working and earning a substantial living. If you're working part-time, making $10,000, $12,000, sure, I can see where that would make sense. But if you're making $50,000, $60,000, $100,000, Social Security is not what you should be tapping before your full retirement age. At your full retirement age and beyond, you can earn as much as you'd like. So many people will take their Social Security at 66, 67 and keep working until they're 72, 73 because they enjoy their job. And I wish that for all of you. At that point, there's no penalty for taking your Social Security. You'll pay taxes on it, as we'll talk about in the next slide, but no penalty for withholding. Now, the tax situation, the pessimists have written this slide because I'm an optimist. I like to think of Social Security as somewhat tax-free. You can see here they mentioned that if you're a married couple filing jointly with a provisional income that you can see detailed at the bottom, over $44,000, where many of us might find ourselves into, then your benefits are 85% taxed. I like to think of it as 15% federally tax-free. And one note, Social Security in 13 states is also taxed at the state level. Mercifully, as of 2021, California is not one of those states. So just be mindful of that. I think of it from a tax allocation perspective. If you're nearing retirement, the more you make of Social Security, hopefully the less you take out of your IRA and your 401k, unless you have a Roth, much of that is indeed federally and state taxable. Your Social Security income is at least 15% tax-free federally and no state income tax here in California. So you can take more of Social Security. Hopefully you take less out of your other qualified vehicles to create the income profile you need. You can have a lower income tax result as well. And as we'll talk about later, hopefully have a lower modified adjusted gross income to have lower Medicare premiums as well. The real strategizing, and we have a case study we'll talk through on the next slide, and then we'll open up for questions. But the real strategizing comes as you are in a married situation. And so one of the great things that happened in the last 6 years, 7 years now, is when same-sex couples were now entitled to these benefits that opposite-sex couples have been entitled to, as you see on the screen. So spousal benefits, you're entitled to your work history at any point in time, right? If you've got those 40 quarters of work history, you're eligible for your benefit. Or if you've been married for at least a year, you get half, the greater of that, or half of your spouse's benefit. So, you have the greater of the two. They're not stackable. You can't get both, regrettably. And one spouse must file for the other spouse to file a claim against their benefit. If they don't file, then they can't file a claim against it. File and suspend used to be a strategy that was out there, and that's gone away about 4 or 5 years ago now. So you can't file until your spouse has activated their benefit. And so that you want to think that through a little bit. I met with a couple years ago whose husband was 72. He had already been filing. Wife was 67. She didn't know she could get spousal benefits. And so she was fully eligible because he had already filed. So if the spouse is over 70, it's evident that it's out there for the taking. So spousal benefits is one. The divorcee benefit is the same as spousal benefits, and in a sense, it's actually more liberal. We have to be married for at least 10 years and not currently remarried. If you're married for 10 years to your spouse and you get divorced, if you're over the age of 62, it's interesting. It's more liberal than for currently married couples in that the divorcees, if your divorce is 2 years or more in the past, the ex-husband can file against ex-wife, even if she hasn't filed her claim yet. So in the currently married couple, I mentioned one has to file and collect and potentially forego any future growth. But for surviving spouses, the benefit is the greater of your benefit from your work history or all of your deceased spouses or ex-spouses benefit, including any growth that happens between 66 and 70. So it's a powerful way to do some succession planning, leveraging Social Security. And so that's something I think is often overlooked. And you can get your survivorship benefits as early as age 60. I've seen some instances where that makes sense. So again, if you take it early, either your spousal benefit, one common misconception is at age 62, you might as well just take your spousal benefit because it'll be 50% of your spouses. It's not entirely true. It's at the receiving spouse's full retirement age where you get 50%. It starts at 35% at age 62, or in the case of surviving spouse at age 60, it starts at 71.5% and grows over time to that larger amount. So here is a case study I think that will help you walk through some strategizing I can share with you. So in this example, we have both Sam and Ann, a married couple for a number of years. Both are age 66, so that's her full retirement age. And so they're the same age. Ann was a breadwinner, and she had a benefit at her full retirement age of $2,400 a month. Sam has a benefit at his full retirement age of $1,000 a month. So what I might counsel this couple to do, because Sam, he can get the greater of his benefit from $1,000 a month or half of Ann's at $1,200 if they take action at the full retirement age. What I might say to them, because if they wait, they can grow their benefits. I'd say, Ann, why don't you wait until age 70? Grow your benefit from $2,400 to $3,168. But Sam, if you need income now, take your $1,000 a month at 66. Enjoy the money. You'll get $48,000 between 66 and 70 plus inflation. So you'll get that amount now, and Ann's benefit will grow to $3,168. So, if Sam waited till age 70, he'd get $1,320, right? But he gets his $48,000 for 4 years total. And then at age 70, Ann turns her benefit on. Once she does that at $3,168, then Sam can amend his filing to file for the spousal benefit that he's eligible for. And so he won't get $1,320, he'll get $1,200 because your spousal benefit is half of the benefit you receive at full retirement age. It doesn't grow between 66 and 70, but he'll get $1,200 or $200 increase, a little less than he would have gotten at age 70. But at the same juncture, he'll have received $48,000 for 4 years. So that's one example I think is a nice way to frame how we might want to think about strategizing for your Social Security. So I'll stop my share there and open it up for questions. Bring Susan back on. Susan, if you want to come back on and we can address some questions.
Okay, great. Thank you, Ian. We do have some questions in the Q&A box. And the first one is from Mark. He says that he's turning 70 next month and he's still working. But he started taking Social Security just 2 months ago, but went back 6 months at the suggestion of an agent who managed his application. Was he wrong to have taxes taken out of his Social Security checks? And he doesn't trust that the government will still try to tax him for his Social Security and his job.
Well, I think the tax question, and again, I should say I'm not a tax advisor, so just full disclaimer there, but I think the taxes can be withheld because that'll get trued up when you file your tax return, right? So if you overpay your taxes from the withholding on Social Security, it'll come out in the wash as you file the remainder of your income picture to the IRS. So on that regard, it depends on your income tax filing situation. I think it was a good thing for you to go back 6 months because you can, and it brings up a good point, you can file for benefits you were entitled to that you had not yet filed for, but only 6 months in arrears. So that's why you went back a little bit to get some income for a longer period of time at, a 69-year-old payout rather than 70.
Okay, thank you. Joe asks, how much can I still earn without reducing my Social Security payment?
Well, so if you're taking Social Security before your full retirement age, that's where that, call it $19,000, $18,960 income cap comes into play. But if you're at your full retirement age, which is either age 66 or 67 and beyond, you can earn as much as you'd like, and there'll be no reduction on your Social Security. It's only if you take action on your Social Security benefit and you're still working between the years of 62 and your full retirement age.
Great. We have another question. Someone asked if I can make returns in the stock market like 29% and 15%, as we have in the past 2 years, why wouldn't I take my Social Security at 62 and invest it?
So, that really depends on your longevity, right? If you think family history, personal medical history, you won't make it to 75, 80, then you may very well want to take it earlier, invest it, maximize it. But that 8% increase that you get, throughout that spectrum between 62 and 70 grows by 132%. So that 8% growth that you get over those 8 years is pretty dramatic. And so what you can do, and that number will live as long as you do. So if you live into your 80s and you live into your 90s, that 8% growth is compounding in your favor. It'll turn into a much larger number over time if time is something you think you'll be afforded, right? If you don't have a long expectation of your longevity, I might advocate for you to take it early and make the most of it. But the 8% guaranteed income from the government is a far greater rate than you get in other conservative investment vehicles right now. Susan, were there other questions?
I have 2 more questions.
Okay, sorry.
What happens if my spouse worked for the public sector and gets a pension where they didn't pay into Social Security?
So that one's a tough one. There's the government pension offset for spousal benefits, where they'll take 2/3 of the pension amount away from the spousal benefit that they would receive. So if your spouse worked and earned a $3,000 pension and was hoping to get, call it $1,200 maybe on a spousal benefit or $2,400 on a survivorship benefit, they won't get anything or hardly anything, because you'll take $2,000, 2/3 of the pension amount out of that. So it really changes the calculus in terms of planning for that. If the caveat to that is if you've worked for 20 or more years in the private sector as well, they work that penalty down a ways. So many people who've been lifers in the public sector won't get much. They'll get the 2/3 elimination of their pension.
And another question from Mark Brown is, do you feel that the government can afford cost of 5% per year?
It will be a challenge. The Social Security funding is going to be a challenge in general. The one saving grace I'll share with you, and the 2 solutions I briefly mentioned, were to increase the income. Just a few years ago, it was $118,000, and the income that you're paying 6.2% of your earnings, and your employer matches that for an aggregate of 12.4% of what you earn. Up to $143,000 this year is going into Social Security. That number will likely continue to march higher into the 200,000s, and it's actually fairly equitable if we do the math for it to do so. The hard part is this: the baby boomers are a large generation who are consuming Social Security right now, the last 5, 6, 7 years. The echo boomers are actually a larger demographic than the baby boomers, but they're not in the peak earnings years to fund the pot for the boomers. So coming out of coronavirus times that we're in, hopefully we could get the echo boomers the millennials into better, higher paying jobs. It would actually solve a lot of the demographic issues surrounding Social Security in the short term. But as I mentioned, I think for a lot of younger recipients, we're going to likely push out the burden on Social Security out a few years to the full retirement age of 68, 69, or 70, taking pressure on the back end while you raise funds from the increase in income taxes in the interim. We'll keep the system afloat. I wouldn't say we'll keep it flush, but we'll keep it afloat.
Okay, great. Thank you. And you can continue with the next part of your presentation on Medicare.
Excellent. Bear with me 1 second. I will share one. Let's see from current slide. There we go. I hope, can you see my slides okay, Susan?
Yes, I can.
Okay, excellent. Sorry about that before. So now, yeah, we're going to shift from one of your core income sources throughout retirement to one of your larger fixed expenses. You know, the largest fixed expense for most seniors throughout retirement is their housing, and that's fair. The second largest one is Medicare. Yet when you survey pre-retirees, still 1 in 3 think that Medicare is basically free throughout retirement. So there's a disconnect there. And so I want to make sure you understand what Medicare will cost and some key concepts on what to understand as you make your decisions to make sure you have the best possible outcome for your Medicare and healthcare costs in retirement. So you can see the Medicare healthcare costs average about 12% of your overall spending budget. And the average inflation for the last 20 years is 5.8% per year. So here we are hoping to get 3% inflation with a gargantuan amount of stimulus in our economy over the next year. And we're hoping to get 3%. Well, guess where we've seen double that over the last decade and still rising? Medical costs, whether it's drugs, surgeries, different hospital costs, the costs are tremendous. Now, with some careful planning, you can alleviate much of that, which is great. But we'll talk about that. But a retired couple with average expenses over the course of an average retirement, living to your mid 80s for life expectancy, will need about $280,000 to cover your out-of-pocket costs with Medicare in place. That does not include Medigap, which we'll talk about later as a potential solution for all that. And really, I love this slide because it shows you embarking upon your Medicare decision. You have 2 distinct tracks, but it's in government lingo, so it's very confusing. You have Part A, which is your hospital costs. Part B, which is your preventative medicine, doctor's visits, outpatient care, and the like. Part D for drugs, and then Medigap. Medigap is also known as a supplemental plan. It fills in the gaps that Medicare creates, and we'll talk about that in a little bit. So that's traditional Medicare on the left-hand side of your screen, and 88% of America chooses to go down that road. Now, living here in the East Bay, I know Kaiser is fairly ubiquitous. I think half my neighbors work at Kaiser in some form or fashion. And Kaiser offers what they call Senior Advantage. It's a Medicare Advantage plan, which is Part C. And so it's effectively, think of the track on the left as unbundled and the track on the right is bundled. So you have your bundled Medicare Advantage plan where you interface with the Kaiser or Blue Cross Blue Shield or what have you, and you'll work directly with them. And there's some pros and cons to that. They have drug plans. They often throw in hearing, vision, and dental at little to no cost. But some of the deductibles for various hospital events might be different than under traditional Medicare. So what we'll do today is talk a little bit about the costs and mechanics behind both of those. And then I'll mention just some things I'll mention now on Medigap. If you take anything away from our time on Medicare today, I really want you to understand what Medigap can offer to you, because it can be a very reasonable way to take a lot of the uncertainty of healthcare planning out of your world. There's 2 key concerns. There's 10 Medigap plans, and in true governmental fashion, they don't go from low to high. Plan F you might have heard of in years gone by. Plan F was the most comprehensive, and it was eliminated last year. Get my years right. Yeah, last year. And so Plan G is now the most comprehensive. If you plan to travel internationally, if you plan to just travel extensively throughout the United States, Plan G will cover everything but Band-Aids and Q-tips, basically. And so what that'll do, that gap will fill in the 20% copay that you have with the doctor's visits and the like. and the deductibles, which range from $1,400 for the first 60 days for a hospital stay, which isn't too bad. Both my children were born at John Muir in Walnut Creek, and we're in and out of there for about $7,000 per child for a 48-hour birth. So 60 days at $1,400 seems pretty reasonable to me. But month 3 in a hospital stay, if you have an event under traditional Medicare without Medigap, month 3 you'll pay $9,000, almost $10,000 for that month. And as I've done a number of these seminars in person, I tell people, don't think of 65-year-old you having a hospital level event. Think about 80, 85-year-old you having an issue and having months to recover to a good standard of care. You're going to need help. And that cost can really escalate quickly under traditional Medicare. For hospital stay, you're looking at almost $10,000 for months 3, and then almost $20,000 a month for months 4 and 5. After 5 months, you're on your own for that year. So it's a pretty steep cost. And the nice thing is with Medigap, if you were to institute that, it's offered by private health insurers, then that will fill in the gap and you won't pay any of that. And so Medigap Plan G, but here's the 2 key gotchas with Medigap. Plan G is the most comprehensive. So say G is here and Plan B is here, kind of middle of the road. You can start at B, but you can never get up to G. You can only work your way down the ladder. So if you started at G, you could have G, and then if you decide to go to B later, you could do that. But you can never go from B to G. So you can only dial your coverage down over time because they don't want people to game the system, right? And 65-year-old you, pretty healthy, start at B, then when you're older, go to G. That's gaming the system in a sense. They don't want you to be able to do that. The other real key consideration is as soon as you file for your Medicare Part B premiums, which those we'll talk about those premiums are in a second, you would file for that once you've retired from work and you're no longer covered by an employer-sponsored health plan. As soon as you file for Medicare Part B, that starts a 6-month window for you to install your Medigap with no underwriting. So if you had a stroke when you were 63 and you recovered fine, but now here you are 67 years old, you're retiring. As soon as you file for Medicare Part B, you go, if it was me, I was 67 years old, I could retire, file Medicare Part B the next day, file for Medigap, and I'd get the going rate for a 67-year-old male, even if I had a stroke a few years earlier. But after that 6-month window is elapsed, because Medigap is offered by private health insurers, they have a contract with the government, 6 months, no underwriting. After that 6 months from when you file for Medicare Part B, you have full medical underwriting. And I did this seminar in person down in San Jose, and a woman came up to me afterwards. She was paying $1,350 for something that you can see on this slide here, might have cost her $150. So traditional Medicare, you can see the costs here. Medigap will run about $150 on average. Depends on the plan, depends on the provider, but you're looking at between $150 and $210 typically. And so Medigap, for peace of mind's sake, can often be a good investment. But again, you have those 2 key considerations of starting towards a peak, at the peak, and then getting it installed if you have any health history that can be held against you within that 6-month window. So we'll do a quick breakdown of the costs while we're here. Part A, you don't pay for, you pay for it your whole career in a sense through your FICA taxes. So if you have your 40 quarters, again, just like Social Security, then you can get your Part A insurance. Your Part B starts at $148.50, but escalates quickly. So the income tables are pretty amazing, or it can jump dramatically. If you're making over $176,000 as a couple, it jumps pretty quickly. If you make $50,000 more instead of 176, say you make $225,000, you'll pay double the 148. You'll be closer to $300 per person for your Medicare that year. So one thing to note is when you are a new retiree, they're going to look at the last year in which they have full and complete tax returns for you. So here we are, 2021. I know my taxes haven't been filed yet because the tax deadline was extended out, but even so, people have been collecting Medicare since January. So as a result, they look at not last year, but rather 2019's tax return. So if you made $300,000 in your earnings in one of your final working years, that's great. In 2019, you only expect to make $85,000 as a retiree this year. they're still going to charge you your Medicare premiums on the last information they have. So there's a form that you need to fill out to attest that you've had a life-changing event, your AKA retirement, and you're no longer going to earn that $300,000. It's called SSA-44. So if you look up that form on the internet, you'll be able to download it, and you can furnish it to Medicare to tell them with some minor documentation that I'm not making $300,000, I'm making $85,000. So please charge me the premiums I should be paying. And often they will adjust it unless you're trying to pull a fast one on them. So be mindful of that. And again, that increase in your Part B premiums can be managed down with some careful tax planning. If you can withdraw money from other sources and work down your tax burden, certainly if you keep your modified adjusted gross income below $176,000, it'll keep you at that lowest rung for Medicare premiums, and it coincides pretty nicely. I think the tax bracket around there currently is 165,000. So if you can keep yourself under that threshold, you can pay lower taxes. I think 22% in federal tax there, and the lowest possible Medicare premium. A Part D averages $43 a month, but it's actually, in the lower income brackets, it's free. It doesn't cost anything. So Part D has been one of the larger pieces of red ink in the Medicare ledger, but it's a great way to fund any drug costs that you might need. It's subsidized pretty aggressively, where you have a 25% copay up to about $9,000 this year. And then from there, it's only a 5% copay. So if you find yourself in need for heart medicine and diabetes medicine, for example, you can get there by June, and you'll only be paying 5% out of pocket. So Part D can be pretty advantageous. As we mentioned, Medigap. So you can see this example with the lowest income considerations, you're looking at about $336 a month, whereas Medicare Advantage, again, that's the one that's bundled. It's offered by private health insurers. It has many of the features of Medicare, but the internal parts are a little different. And I'll share with you if you want to write down a resource. I think I have it towards the end of the presentation, but there's a great resource out there. Here in California, they call them HICAP, HICAP. And I know there's an organization, kind of private label HICAP people called Senior Advisory Advocacy Solutions. And they do a nice job. They'll do a 1 hour consultation with you and compare and contrast traditional Medicare versus Medicare Advantage. One of the negatives of Medicare Advantage is that it's not portable. So here, Kaiser is very ubiquitous. I grew up in New York and Connecticut, where Kaiser is non-existent. If for some unforeseen reason I moved back home, I love my mom, but no, I love California just as much. Then if I moved back home, I would have to leave Kaiser and their Medicare Advantage plan and start up either with traditional Medicare or with another Medicare Advantage plan from, say, Blue Cross Blue Shield at that juncture, and deal with the inner workings being different at that time. And so I'll show you when you can make changes in the next slide or two, but you can see where Medicare Advantage might be attractive because you don't have to deal with the government. You deal directly with a health provider. Say you're with Kaiser and you've had a great experience. You get to see your same in-network doctors and you deal with the same people just as if you were on your employer-sponsored health plan. And so it does, the premiums, of course, adjust with your taxes, just like Medicare Part B. And then you have an average of about $21 additional, but you can see in this example, that's far less than the other person was paying for their Medigap and for everything else. And as I mentioned, Medicare Advantage often loops in hearing, vision, and dental at little to no cost because they're already providing it for employer-sponsored coverage. It's easy for them to extend it to the retirees. So Medicare Advantage can be attractive, but just understand the workings of the plan you're looking at. The internal deductibles might often be different from traditional Medicare, and it's not portable. So if you ultimately decide you want to move towards the kids or grandkids or something like that, then you want to keep that in mind as you're selecting a plan. Maybe find something that's more broad in nature, not as narrow geographically as say like a Kaiser might be. So enroll in your initial enrollment period would be starting at age 65. You can't enroll before that. You can, but you can enroll the 3 months before your 65th birthday, the month of, or 3 months after. And that if you miss that deadline, you can only enroll in the beginning of the year, the first quarter of every year. Now, that's only if you don't have a qualifying life event like retirement. So if you retired in October of this year, you can retire in a 7-month window around your retirement date. You can file for Medicare. But if you miss that window, you'd have to wait until the following January 1st to do that. And for every 12-month period that you don't install your Medicare Part B, you could have had it, you didn't have substantial coverage from a work plan, and you just decided not to get it. You say, I'm 65, I'm retired, I'm healthy, I'm not gonna start Medicare now, I'll just wait. Well, for every year you do that, there'll be a 10% penalty. So they'll increase your premiums from, say, $148 to whatever that works out to, $163. So they'll increase your premiums to $163 at that juncture, and that's going to live on the rest of your life. That 10% penalty per year, so you accrue it for every year that you wait, will live for every year that you live. So you'll pay that in perpetuity. So it's a real challenge. They don't want, again, people presenting a risk to the healthcare system without adequate insurance. Now, your special enrollment period is, you have an 8-month window, sorry, not a 7-month window, after your employment ends, once you leave your plan. Now, there's a couple of quick caveats. A COBRA, it's come up a lot this year. COBRA is not a qualified healthcare plan. So as soon as you leave your employer-sponsored health plan, even if you're on COBRA, your 8 months are ticking away to install Medicare. And also, I've worked with a lot of HP people in the area here in the Bay, and they have a nice, robust employee-sponsored healthcare plan, which is great. But that also acts as more of a Medigap plan. It's not qualified coverage for you not to sign up for Medicare. So you can sign up for your Medicare Part A as soon as 65. One interesting note: if you're still working at 65 and you're covered by your employer-sponsored health plan, call your benefits department and ask them how your coverage interfaces with Medicare Part A, because if you file for Medicare Part A, there's no cost anymore, right? Because you paid it through your FICA taxes all those years. But I'd say about 20% of the time, the employer-sponsored health plan will make Medicare primary, which reduces the risk that you represent to them. So they'll lower your premiums for your employer-sponsored healthcare plan as a result until you ultimately do retire. So that's one important call to make. If you are working over the age of 65, it's a worthy call to make to your benefits department to see how your coverage interfaces with Medicare Part A. So open enrollment is when you can make a change. So say you were in Medicare Senior Advantage here in California, and I go visit my son in Nebraska and fall in love with Nebraska and say, okay, I'm gonna have to move. Well, there's no Kaiser in Nebraska, so I'm gonna switch from Medicare Advantage, as you see in the second bullet point there, to traditional Medicare out in Nebraska. Well, I can do that, but I can only do that from October 15th to December 7th. So I would either time my move then, or just try not to consume my medical coverage until that date where I can make a change in the new geography I might have. But if you want to switch Medicare Advantage plans, switch from traditional Medicare to Medicare Advantage, you can do all of that, but only in that 6-week window from October 15th to the day that will live in infamy. So just know that that's when you can make changes. Here are the resources. I would say if you go to medicare.gov/contacts, that's where you'll learn about HICAP. And I couldn't advocate enough for them. Call them, and I think they may be only doing virtual still. They typically work out of senior centers and the like in communities, but they'll give you a 1-hour complimentary consultation. They're certified by the state to do that without bias, even though they're often benefits providers for their day job. But they're very knowledgeable and will help you understand, based on your situation, what you articulate to them. Should I do traditional Medicare? Should I do Medicare Advantage? What are the pros and cons? What are my healthcare concerns that I anticipate? What should I be mindful of? But if I can leave you with anything, figure out which way you want to go: traditional Medicare or Medicare Advantage, and certainly be proactive on your Medigap. Often it makes sense to choose Plan G and do it within that 6-month window where there's no medical underwriting to get it installed. So with that was the last slide I had prepared. Susan, I'd like to bring you back on and see if we can't go over any more questions.
Great. Thank you, Ian. We do have a few questions. Let me see if I can pull them up. So this question is from Mark again, Mark, who is turning 70 next month. And he asks, for a working married person who pays about $600 through an employer medical dental vision plan, would you suggest dumping employer provided health care and going with Medicare? He's been given this advice by retirees because then he would not be paying as much.
Yeah, I suppose, there are some variables to contemplate, but I would say it depends on your modified adjusted gross income. So one, I'm assuming you're over 65, right? So, or else you can't get Medicare. But if your modified adjusted gross income is, as a married couple, below 176,000, you will not be paying $600 a month. You saw from that example, even if you do traditional Medicare and tack on Medigap, you're looking at about $336, I think it was on the slide. So call it 350. It would save you quite a bit. It depends on the particulars of your situation, both from your doctor's standpoint. If you're in network at Kaiser, you could do traditional Medicare or Medicare Advantage. And that would, and Medicare Advantage might very well include hearing, vision, and dental as well, as you mentioned. But all of those results will be lower than 600. So provided, unless your income is north of 225 or so, then you'd be paying less than the 600 you're paying now.
Another question we have is, do I need Medigap insurance if I choose a Medicare Advantage plan?
No, with the caveat of it depends on the Medicare Advantage plan, because as I mentioned, they're all offered by private entities. So the nuances are a little different, but many of them, I'd say, emulate the features of Medigap. So they'll reduce many of your out-of-pocket costs by going through the Medicare Advantage. And so you wouldn't need to bolt on Medigap to that, because they'll be doing a lot of the performance of that, depending on the structure of the plan with the Medicare Advantage.
And another question we have, are supplemental plans like AARP through United Healthcare in addition to Medigap, or do they overlap?
That's exactly the same thing, actually. So, if you watch the news on Sundays, you're going to get inundated with Humana, AARP. You can't turn on an ad break without getting a Medigap commercial. So that AARP United supplemental plan, that is Medigap. There's two names for the same thing. Medigap and supplemental insurance are exactly the same thing.
Two more questions.
Sure.
That if you are still working and receiving health insurance through your employer, do you have to sign up for Part D when you turn 65?
No, the only one you would sign up for is Part A. And the benefit of that is there's no cost, right? You paid for it through your payroll taxes your whole career. So Part D, you would often do when you sign up for Part B, which is whenever you leave your employer-sponsored coverage. So because there is a premium involved with it, if you're already covered for a drug plan under your current employer-sponsored health plan, you'd be paying two premiums for the same thing. So you wouldn't sign up for Part D until you left your employer-sponsored health plan, started your Medicare Part B, and then you just start Part D at the same time.
And the last and final question, does Medicare cover my long-term care needs?
So the answer is no. And so Medicare, I mentioned, as you have a hospital level event, you go into hospital for a month or 2 months, and see, I have a financial advisor I work with who is blind and fell down a flight of stairs recently. So she's been in and out of hospital care for 4 months now. And as she's recovering, as people like that recover, if you can't get back to a level of care where you can care for yourself on a consistent basis, and you need longer term care, Medicare will eventually have to hand you over to other means. And so if you stop showing signs of progress, the doctors document it, you'll no longer be covered by Medicare. And that's where things like long-term care or just self-funding, or like long-term care insurance, things like that can then kick in to shoulder the burden of giving you a good quality of life.
Great. Well, thank you, Ian, so much for your presentation tonight. It was very educational and informative. And thank you to everybody who attended and joined us tonight. If you enjoyed tonight's program and look forward to more, we invite you to make a gift to the Walnut Creek Library Foundation. We hope you will join us for our next live from the library program on May 12th at 7 p.m. We have a distinguished panel discussing the topic, Showing Up Boldly, the Political and Organizing History of Black Women. To register for more information, please visit our website, and the link can be found in the chat box, or you can go to wclibrary.org. Thank you again for attending, and good night.